I want to share with you the most important thing that every type 2 diabetic and the 100 million plus pre-diabetics in America need to know to reverse or prevent type 2 diabetes. In 2001, researchers published a landmark study in the prestigious Journal of the American Medical Association. The researchers wanted to compare lifestyle or behavior to the leading diabetes drug, Metformin. What they found was amazing. When compared to placebo, a sugar pill, the drug actually worked. It was 31% effective in reducing the risk of tipping from prediabetes into becoming a diabetic. However, making the lifestyle or behavior changes were even more effective than the leading drug today, Metformin. Lifestyle changes were 58% effective. Yes, more effective than the leading, most popular drug, 58 to 31, dramatically better. But astoundingly, lifestyle was 58% effective when study participants were simply told about the behaviors, but they didn't actually do or make the changes. That's right, they didn't even do the actual behaviors. Researchers then looked at those who actually made 4 of the 5 behavioral changes. In those study participants that made the lifestyle changes, there is a 100% risk reduction. In plain language, not a single pre-diabetic became diabetic over a multi-year study. Not one. You might be thinking, so what if I'm already type 2 diabetic? Will it work for me? Evidence has proven that it does. Anderson and Ward switched diabetics to a high-carb, high-fiber diet versus a high-fat, low-fiber diet. In the study, insulin requirements were reduced 60%, and half of the diabetics were able to come off of all their insulin. You might be curious about how many months or years this took. Well, it took 16 days. That's right, 16 days. So some of these diabetics that had been diabetic for as long as 20 years, injecting up to 20 units of insulin daily, and as few as 13 days were off of all the insulin. Here at PDO Healthcare, we help diabetics and pre-diabetics reverse and prevent the condition for $10 a month based on a subscription. You can cancel anytime. I'm Dr. Michael Imani, Executive Director here at PDO Healthcare. We're a nonprofit dedicated to the reversal of type 2 diabetes and the prevention of prediabetes for $10 a month.
So, what were the 5 behaviors that diabetics and pre-diabetics used to reduce their risk 100%? Number 1, reduce their weight 5 to 7%. Number 2, make sure your fat intake, total fat intake, is less than 30% of your overall calories daily. Number 3, saturated fat intake should be less than 10% of your entire energy intake daily. Number 4, increase your fiber to 15 grams per every 1,000 calories consumed daily. That'll be different for men and women. Exercise at least 4 hours or more per week. If you can do these 5 things, you'll be successful.